Hi, I am Dr. Tammy Dobbs. I'm a licensed clinical psychologist in California on the Central Coast. I work with children, teenagers, and college students and their parents as it pertains to their kids. And lately I've been asked a lot of questions about attention deficit and hyperactivity disorder. Where do I go to get the diagnosis? How do I know if I have the diagnosis? What do you do if you actually do have the diagnosis? So I thought I would put a video together and see if I can answer some of those questions, something for my patients to refer back to, as well as maybe some of you out there who are watching this, and it'll give you some direction on what to ask your own pediatrician or psychologist and kind of give you a guideline to get started in your journey if this is it. So ADHD affects about 6 million children in the United States. It's a chronic disorder that appears in youth, and it's categorized by attention dysregulation. It can be just the attention piece where they're having a hard time sustaining attention or regulating their attention, meaning over-attending to an area of interest. Or that hyperactivity part where they're very impulsive and flirting and can't sit still, and or the combination of both. So it doesn't have to be one or the other, and it can be either or the combination. So the three presentations. So we just talked about that, but what does that look like? And how do you know? Like, gosh, don't all children act kind of distracted and a little bit wiggly when they're young? And you're right, they do. Specifically under the age of 4, it's pretty hard to know. And a lot of people will say, gosh, there's so many people diagnosing ADHD, it's an overdiagnosis. And in actuality, it's pretty difficult to diagnose somebody with ADHD. So who do you go to get that diagnosis? So pediatricians, they can diagnose and provide medications, but not the behavior treatment. Psychologists, effective at diagnosing, they can provide behavior treatment, but they can't prescribe, at least in California. Psychiatrists, they can diagnose, they can treat medically. And so, we can go into a little bit more detail about, well, what tools and strategies do all of these people use when they're diagnosing your child? There's the questionnaire rating scale that pediatricians will often give to you, and maybe for you to give to their teachers, the Vanderbilt. The behavior assessments that you'll maybe see at a psychologist's office, or even sometimes at schools, although they don't diagnose ADHD in a school environment. And neuropsychology testing, and they use a variety of tools to, one would be the CPT-3, but also other tools that can find out, well, gosh, does my child have something else going on? How is this going to affect their learning? How does it affect their ability to achieve in school and in other areas in their life? So that's a very thorough type of testing, and ADHD is often co-occurring with other diagnoses. So the pharmaceutical treatments, stimulants, it's about 70-80% effective, and it affects the dopamine, and it usually starts working in about an hour. So it's not like maybe some other medications that it can take 2 to 4 weeks. This is pretty quick, and it stops when the medication stops. So a lot of my families will say, gosh, the school says they're doing great, but then they come home and they won't sit at the table, they won't do homework, and all of these kinds of things. And so that would be something you could talk to either your pediatrician or your psychiatrist about. There's several types of medications, there's different times of day you can give to them. And the thing I hear often from my patients is the 2 side effects can be insomnia and it can be appetite loss, but they can work with you to minimize those side effects. So let's keep going here. Non-pharmaceutical type treatment, so behavior management. You can see a psychologist for that. You can even go to a behaviorist, a board-certified behavior analyst. And the behavior management is, what can we do in the school environment and the home environment to create success for this individual? Maybe it's programs to reduce blurting, or walking with a group, or standing in line without touching the person in front of them. A lot of social skills training. Social skills are a big deal to a child with ADHD because they're the kid that's impulsive and running around and not realizing that they're not playing the game the way everybody else is because they're moving at such a fast pace or not attending to the social cues. So that can impact their social relationships. Parent training. Parents are constantly going when they have a child with ADHD. I often hear, gosh, I just can't get them focused long enough to get dressed and get their teeth brushed and get out the door. And in other cases, it's like, oh, we're always forgetting the library book, or we're, forgetting we don't have shoes today, or, whatever it might be. Helping the parents create an environment that works better for them and their child, even some simple environmental arrangements, such as, bedtimes, eating times, whatever it might be. And helping parents with self-care. It can be tiring going at that fast of a pace to even keep up with your child. So these are a few different strategies. We talked about WHO diagnosis, basically what it is, what type of strategies are used, what tools are used, what you can do pharmaceutical-wise, non-pharmaceutical-wise. At this time, the stimulants are considered the first-line treatment. Stimulants and behavior management is also considered. It's right there with it. Behavior management is an option. It doesn't seem to be as effective as the combination or the stimulants, but it gives you choices. And there's also, there's other treatment options out there that you can explore with your provider. And hopefully this was helpful for you. It's a first step as to what you can do. And if you like this video, please share it, hit like, and thank you for sharing this time.